Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and I'm a functional medicine physician. And today I want to talk a little bit about weight loss. Many people are struggling to lose weight these days, and many times the focus is on the wrong factors. There's a lot of attention put on the thyroid or how many calories you're consuming or how much you're exercising. Now, those things are relevant and important, but many times people don't have a thyroid problem. Many times they are exercising enough, and many times it's not because they're really consuming too many calories in order to lose weight. So other things that really interfere with weight loss go back to metabolism. So when we talk about metabolism, that's turning food into energy or turning body fat into energy. You do have to burn body fat. It doesn't just go away. So you have to turn it into energy and use it, because that's what it is. It's stored potential energy. We just have to get that body fat and have it being used as an energy source in the body. So when we talk about metabolism, we begin actually in the brain. So your brain tells you if you're hungry or when to eat or how much to eat or when to stop eating. That would also involve things like cravings and things along that line. So the intake part of it is being managed by the brain, and then we go down through the line, and there's many things that will influence the ability to take that food or body fat and turn it into energy. That's where the thyroid does come into place, but lots of other things come into play, such as blood sugar levels or insulin levels, inflammation levels. The reason these are really important because these are going to have a significant impact on little structures inside of your cells called mitochondria. So the mitochondria are what really take the food or the body fat and turn it into the energy the body uses. So food or body fat needs to be turned into something called ATP. You might remember that from biology class, but that's where we need to end up. But that's a function of the mitochondria, and the mitochondria are influenced by inflammation levels or toxins, and they have their own nutrient requirements. If we have imbalances of other hormones, this is where insulin can have a negative impact on them, or other hormone imbalances. The thyroid does play a role in this part of this as well. It's just that we have to look at the different types of things that could influence essentially our ability to take food or recruit body fat and use it as an energy source. And that's what we're talking about with metabolism. So maybe you're going to the gym 5 days a week, and maybe you have reduced your calories, or maybe you've changed your diet in some other way. And if things aren't working, if things aren't balancing out, you're not seeing changes, then there's something in the middle. There's something in this whole spectrum going from the brain and the intake and regulating other factors, but also going all the way to the other end, which is inside the cell, which is involving your mitochondria. These are the structures that actually burn the food or burn the body fat, basically burning it, meaning turning it into an energy source that we can use. So sometimes we need to shift our focus and look at these things in between. They're going to affect our metabolism, and not just looking at the intake of food or how much food and then how much we're burning through, let's say, exercise. Okay. So if you want some more details on this, the mitochondria and where they come from and all that sort of thing, check out the blog.